Mr. White?
Yes.
You understood what I've just said to you.
Yes. Lung cancer. Inoperable.
Chemotherapy-induced nausea and vomiting is one of the most common side effects of chemotherapy treatment. Nausea is uneasiness of the stomach that often comes before vomiting. Vomiting is the forcible voluntary or involuntary emptying of the stomach contents through the mouth. Pathophysiology of chemotherapy-induced nausea and vomiting include central pathways, peripheral pathways, and various neurotransmitters. Central pathways includes a chemoreceptor trigger zone, which is an area located outside of the blood-brain barrier in the medulla oblongata. Peripheral pathway involves the vagal afferent nerves in the gastrointestinal tract, and various neurotransmitters include dopamine, serotonin, neurokinin-1, and cholecystokinin, which are activated by chemotherapy treatment. Types of induced nausea and vomiting include acute nausea and vomiting, which occurs within 24 hours of chemotherapy treatment and mediated by peripheral pathways. Delayed nausea and vomiting that occurs after 24 hours of chemotherapy treatment and is mediated mainly by central pathway. And anticipatory nausea and vomiting, which occurs before a chemotherapy treatment begins and is triggered by sounds, smells, sights of chemotherapy. Complications of nausea and vomiting induced by chemotherapy treatment includes esophageal tears, malnutrition, electrolyte imbalances, dehydration, and decreased compliance of chemotherapy. Classification of emesis induced by chemotherapeutic agents. There are three categories of chemotherapeutic agents classified according to their emetogenic capacity. First category includes high levels of emetic agents of chemotherapy and include cisplatin, cyclophosphamide, carboplatin, and dacarbazine. Second category includes the moderate level of chemotherapeutic agents. They include busulfan, arsenic trioxide, doxorubicin, epirubicin, ifosfamide, imatinib. And third category includes low levels of emetic risk caused by chemotherapy treatment and includes 5-fluorouracil, gemcitabine, mitoxantrone, docetaxel. Treatment of induced nausea and vomiting includes non-pharmacological and pharmacological treatment. Non-pharmacological treatment includes hydration with clear fluids, return to normal foods slowly, try ginger, monitor the temperature of the food in rooms, avoiding strong smells and scents, and reporting nausea to the healthcare team. Pharmacological treatment includes serotonin antagonists such as ondansetron, granisetron, and idolasetron. Olanzapine, which is a dopamine antagonist drug. dexamethasone, which is commonly used in the prevention and treatment of chemotherapy-induced nausea and vomiting. Neurokinin 1 inhibitor, such as aprepitant. Pharmacists' role is to ensure patients' therapies are consistent with guidelines recommendations. Pharmacists should educate patients about chemotherapy-induced nausea and vomiting and the various non-pharmacological and pharmacological treatment options available, and patients should be counseled on the use of each medication and the reasons for strict adherences in order to avoid severe complications.